Hi, this is Dr. Arun Kannan, orthopedic surgeon from Apollo Hospital, Chennai. I specialize in hip and knee surgery, and in this video, I will talk to you about a new technique for hip replacement called direct anterior hip replacement. Hip replacement is an extremely successful surgery, and it has been going on for the past several decades all over the world, and it has produced tremendous results, and it has solved the suffering and pain of millions of people. It has had over 95 to 97% short-term success rates. It is not easy to make a procedure that is doing so well even better, but as a scientific community, the medicine people or the medical community is always trying to do something better. And one such thing that has happened over the last 10 years is a new technique called direct anterior hip replacement. So traditionally, when we did hip replacement, it was mostly for old people who had not so much activity as compared to people who are now requiring it, especially in our country, for this particular surgery. So earlier when we did hip replacement, we did it either from the back or from the side of the thigh or the buttock region, and this involved cutting few muscles to reach the hip joint. We used to call them posterior approach or lateral approach, and each of these approaches we have to cut through 3 to 4 muscles to get to the hip joint. However, with this new technique, which is called direct anterior, we approach the hip from the front. So in this technique, we are able to directly access the hip joint without cutting any muscles. That is the major advantage of this hip replacement surgery. So the incision is also smaller. Generally, traditionally, the hip replacement used to involve an incision of about 6 to 8 inches. We are now reducing it to about 3 to 4 inches using this minimally invasive approach. We go directly through the front, between the muscles, directly reach the hip joint, and we are able to expose the hip joint very well. But this approach requires training and practice to perfect it. That is, it involves a learning curve. Once we have done that, then we get as good exposure or even better exposure than what we are traditionally used to. The other advantage of this approach is that the patient is lying supine instead of on the side like for a traditional hip replacement. We can easily bring in the X-ray machines and easily assess the position of the hip joint while we are doing surgery. So when the patient is on the side, it is difficult to bring in the X-ray machine, get an idea of what the position is. However, in this approach, patient is lying on the back like a normal person. So the X-ray viewing and the quality of X-rays is much better. So we are able to accurately assess the position of the implants on table very well. Now we are also combining this direct anterior approach with robotic hip replacement surgery. This makes it even more accurate for the implant position. So when we do not cut muscles, the inflammation is less, the intraoperative blood loss can be minimized a lot. So intraoperative blood loss, if a proper technique is followed through the anterior approach, we can minimize the blood loss quite a lot because muscle injury or muscle cutting is not there. The advantage that the patient perceives at the end of the surgery is, number one, because muscles are not cut, the pain is less. Number two, the recovery is easier. When the muscles are cut, they are sutured together, but it takes time for the muscle to recover back to its original strength, and it may not come back to 100% original strength even if it is sutured well. Therefore, in this approach, because the muscles are not cut, they are strong from the immediate post-op period, and therefore the recovery is quicker. Here you can see this person. He had a hip replacement surgery only 1 week earlier, and he is able to walk without any support 1 week from the date of surgery thanks to the direct anterior approach. The next advantage is that traditionally after a hip replacement we placed quite a few restrictions on the patient in the immediate post-operative period. We asked them to keep the legs apart, keep the knees apart, keep a pillow in between the legs in the immediate post-op period. The direct anterior approach, as because the muscles are preserved, the hip stability is also much better. Therefore, none of the precautions that we advocated earlier as far as hip position goes applies to these patients. They are able to sit and get up comfortably very early after the surgery. So just to summarize, direct anterior approach is a new approach that has been popularized over the last few years, where we approach the hip joint directly from the front. The incision is smaller than the traditional hip replacement. No muscles are cut. We directly approach the hip joint. During the surgery, X-rays can be easily taken and the component position can be ascertained. Post-op, after the surgery, pain is less, recovery is faster because muscles are not cut, and because the hip is more stable, then the position restrictions are not there. Thank you.